Well, what that analysis did is look at the patients. So the OPTIC trial is this study of Ponatinib looking at 3 different doses, starting doses, 45, 30, and 15, and then with a mandatory reduction to 15 milligrams once the patients achieve a response. And what this analysis does is look at the outcome by the mutation status of the patient. So the overall analysis showed that 45 milligrams was the most effective of these doses. In this analysis, we focus on by specific mutation status. One group is the patients with the T315I, the other one is patients with other mutations, and the other one is patients with no mutations. It shows that for all these groups, 45 milligrams seems to be still the best one. But it's clearly relevant in the patients with the T315I. That's when you see the biggest difference. The response rate drops from like 60% for the primary endpoint to about 30%, so almost doubling the response if you use 30 milligrams. So that's very important to know, and it's interesting because we know, for example, with asciminib, the other drug that we have that works against T315I, we also need higher doses for that drug. But the other thing that's interesting is there is some difference in favor of 45 milligrams for the other groups as well. It's not as big, but there's also a difference. Curiously, the patients who have the worst outcome overall are the patients that have no mutations. So there's evidently something else in addition to the kinase inhibition that we need to do about those patients that now we need to understand and explore.